Let's explore what we really mean when we say healthcare should be seen as a public good. Hello, and welcome to the Intersection Podcast. The Intersection is a project of the Robert Wood Johnson Foundation, built to create space for healthcare advocates and leaders to share how they're working to build anti-racist healthcare systems. I'm your host, Anton Gunn, and today's episode will center around how we can begin viewing healthcare as a public good that supports communities' wants and needs. To help us navigate this conversation, I have here with me Aija Nemer-Aanerud from People's Action and Lindsey Muniak from the Debt Collective. Lindsey, Aija, you probably don't know a whole lot about me, so I'm gonna give you one quick 2 minutes. I'm a former organizer. I started organizing on healthcare access issues in 1996, knocking on doors in low-income public housing projects in Columbia, South Carolina, really focused on access to Medicaid for poor people. The second thing that I focused on is holding a local hospital accountable for how they treated people who were poor and uninsured. And now my role is to help bring voices like yours to the table, to the intersection table, if you will. To get us started, my very first question is that I want you to share a little bit about the work your organizations are doing. And I'm going to start with you first, Lindsey.
I work for an organization called the Debt Collective. We are a debtors union, by which we mean a movement of debtors organizing to turn our individual financial burdens into collective power, to win both immediate debt relief for our members, but also to grow the broader movement for what we call reparative public goods. So a system of public goods in which people aren't forced into debt for basic things like healthcare, housing, education. And I lead our work on medical debt and the healthcare system at Debt Collective. There's a distinction when we talk about our work on debt. We talk about debt abolition as our project. And we feel that this is important because, as opposed to debt cancellation, which we imagine as sort of immediate relief, but not necessarily like a longer process, we want to abolish the conditions that trap people in debt for these basic public goods in the first place. And from our perspective, that entails restructuring, transforming the healthcare system as it exists currently.
That's phenomenal. I want to learn more about what your work is at People's Action. Tell me, what are you doing there?
Yeah, for sure. And glad to be here with you. So People's Action Institute, we are a national network of community organizations, folks coming together in a specific geography, state, city, county, whatever, organizing people around, in our case, economic and racial justice issues. There's also gender justice, environmental justice, but economic and racial justice are kind of the bread and butter. And so we've got about 43 affiliates across about 30 states that are all working on these issues like housing, healthcare, environmental justice. And the healthcare piece specifically, we're a democratically organized group. So we've got representatives of all of our affiliates making the strategic decisions. So everyday people kind of making decisions based on what they and their communities need. And a few years back, that representative body decided that Medicare for all was a North Star for us. So what that would mean is like everybody in this country has access to healthcare as a basic fundamental right. And we're very far away from that right now. We're taking steps backwards right now, as I think we can all see. Our work at People's Action has been focused on a couple lanes there. One is, how do we shift the political terrain that we're on to make it more possible to win the Medicare for all single payer system? And for us, that's like building people power, right? Organizing folks, coming together, investing in public goods like Medicare, Medicaid that are truly public. And it's also kicking the profiteers out, right? Like all these for-profit insurance companies, hospital systems, pharma, et cetera. And then the other piece of this work is really getting people relief right now, because folks can't wait until however long it's going to take to win Medicare for all. And so we've been doing a lot of work around defending Medicaid this past year. And that was a rough journey, but we're committed to doing work at the state levels to counteract the damage that has been done at the federal level, and really forcing a choice for elected officials at the state level. Like, yeah, you've got these cuts coming down, but you can decide how they're going to land on people. You can generate progressive revenue, or you can make things even harder for the most marginalized. So That's like a little taste of some of what we do.
Great to hear. I'm going to stay with you for a minute. How do you get to a decision-making process around the issue you want to focus on? Right now, everything is under attack. All the social safety net is under attack. Many of the organizations who've been doing this work for a long time are also under attack. So with all of the things that are happening, how do you determine what to focus on? What's most important right now, given all of the challenges that we're facing?
Yeah, what you're naming really resonates. There's a couple pieces to this. One is we as a national group, our priorities are set based on our affiliates, and our affiliates set their priorities based on their membership, right? There's like in community organizing, kind of a basic principle of you got to go where the people are going, right? Like without having a base of people that are invested in something, you're not going to get anywhere. And then at the same time, there's also some strategic direction that staff who've been around help bring into some of these spaces. And the questions that come to mind for me and for some other folks I work with are like, what is most urgent and pressing for our people? Where are we best equipped to have an impact based on the type of experience we have, the resources we have, and where are there gaps that other people are not stepping in? And it's tough because like there are going to be things where we have some relevant experience, there are gaps, and also it's an urgent crisis, but we have to kind of look at what is the best fit among those things. And that's what brought us to Medicaid in particular. Almost all of our folks are on Medicaid, and those attacks are dire. Biggest cuts to Medicaid, I think, ever. Yeah.
So Lindsey, I'm going to ask you the same questions. Everybody knows that debt is a bad thing, but there's so many different types of debt. And so how do you all get to a place of identifying what's most painful, what's most urgent?
So one way that I talk about how Debt Collective uses debt within the organizing process as like a point of entry for people, in part because one of the things that anyone, I think, who has spent some time doing community organizing has probably become aware of is the role of shame and alienation, isolation in producing this system that actually upholds this corporatization, commodification of all these things that all of us need to survive, of healthcare, of housing. And so we talk about debt as a tool of social control that drives that shame. And so the entire project of the Debt Collective originates from this realization that actually everyone's feeling economically squeezed, increasingly so, because of the way that we've been taught what it means to be a moral, good person. It means to pay your debts. It means not to owe people things. We tend to blame ourselves for that economic squeeze, for being a little bit overstretched, for not being able to pay our phone bill this month, for having to take out an extra credit card to buy groceries, or having to borrow money from a family member or friend. Best case scenario, you mentioned payday lenders. I mean, that's where a lot of people find themselves, especially in communities where people don't have a lot of intergenerational wealth, which is why debt is so disproportionately experienced in communities of color. And so our whole approach to organizing starts from this understanding. Debt functions as a tool of social control. Because we feel ashamed about our debts, we don't talk about them. And all of that reinforces a system in which we all feel like we just need to grind a little harder, work a little more, pick up an extra job, be a little bit more financially savvy, then maybe we'll finally be on par with everyone else. And what we try to do is sort of interrupt that and get people talking with each other about their experiences of debt, get people sharing in these supportive, facilitated spaces. For a lot of people, it's the first time that they've ever talked about it, and help people see actually that this is not an individual moral failure, their indebtedness, but rather a societal failure that we can fight collectively. We're like a very small org, even though our scope is national. Small teams that work on healthcare, housing, education, and that try to really kind of like pinpoint opportunities, some of which are things that come up organically through processes of supporting our members with, for instance, medical bills that they can't pay, and realizing how many people qualify for hospital financial assistance, how underinformed people are of that option, despite the fact that nonprofit hospitals get these enormous tax breaks and subsidies. So we'll have campaigns sort of emerge from this support that we give people one-on-one.
That's a good segue to my next question. How can organizations help the public understand that inaccessible and unaffordable healthcare is a part of a larger unjust system designed to oppress certain populations. So how do we help connect those dots for people? How do you connect those dots for people? And Aja, I'll start with you to give me some sense of what handles do you use to help people to see how everything is connected and interconnected?
Yeah, that's a great question. Because the system's so big, right? Like you're touching an elephant, but you don't know it because you're just at like the tail. The system is so big and so complicated, and purposefully so. It makes it very hard for people to navigate and to even approach these issues collectively, right? It feels, like Lindsey was saying, very much like your individual problem that, oh, I didn't fill out this paperwork right, or I didn't know I could appeal this thing. And so being able to look at the whole thing and who is actually profiting and who's benefiting from the system set up the way it is, I think is really a fundamental piece of our work, especially in a moment when we're seeing so much polarization, like really intense polarization in our country, and that polarization encouraging us to blame each other when ultimately it's not like left versus right or people of color versus white people or trans people versus cis people. It's like top to bottom, right? The top is exploiting all of us. You can have a conversation with just about anybody in just about any part of this country. There's some common ground of like, oh yeah, this company is screwing me over, it's screwing you over. So there's an element of helping people reframe the problems that they're experiencing and who's responsible. And there's also just making it concrete and not abstract, like, oh yeah, the system should do this for these people, but it's actually like, oh yeah, your neighbor can't get the care they need, your cousin can't get the care they need. What would it look like for that to actually work for them?
That's good. That's really good. Now, I want to take this up another level from connecting the dots for everyday people to see it. But let's talk about organizations, healthcare organizations, but may not necessarily be advocacy focused or organizing focused. What can organizations do to contribute to your work who are not necessarily an immediate ally? And sometimes they might even have been an adversary for you in some way, shape, or form in your campaigns. Lindsey, I'll start with you. What can healthcare organizations contribute to your work?
Oh, wow. Yes, you mentioned sometimes they've been adversaries, and a lot of our work on medical debt at the Debt Collective has focused on attempts to hold the hospital industry accountable.
Mhm.
So, yes, I am very familiar with various state hospital associations and the National Hospital Association lobbying against us. But I think a really important point here is, as you mentioned, you worked within one of these equity offices within a hospital. And the truth is that healthcare in general is like the largest employment sector in almost every single state. There was recently a study that was put out by the New York Times. These organized institutional interests, where we have the hospital associations, the insurance lobby, do not, in many, many cases, actually reflect the workforce. People who are in your role, or people who are techs, people who are doing blood testing for folks, nurses, other clinicians, caregivers, service workers. And so one of the things that we are most interested in when it comes to like working alongside the people who are affiliated with those institutions is, yes, finding common ground with hospital associations when we can, where we can, but also working with workers and directors of different centers that are focused on health equity, changing health outcomes, and unions representing those workers to sort of push things from that direction rather than from the C-suite direction. And I think, of course, investing in these programs, which one of our sort of fears is that with these cuts to Medicaid, to other forms of healthcare funding that like in various directions make their way through the hospital industry, that what we'll see is actually the administrators who Debt Collective we tend to not get along as well with will use those cuts as justification to cut some of these really critical programs. And part of that is just because they want to invest the money elsewhere, often toward a kind of like expansion of facilities, renewal of facilities, sometimes corporate salaries, various contracts, and so on. But also there's this fear of the current administration, fear of going against the current administration. And so I think that in a kind of like very broad sense, like what we need from these organizations, associations, unions is to be brave and to fight actually for not only the continuation, but the expansion of programs. It's an ask that goes out to various institutions and also to everyone who hears this is just like be courageous in this moment.
Being courageous is something that I think we all could do a lot more of, and a lot of organizations know better, but sometimes don't do better or say better because they don't have the courage, which I think is a good segue to a question that I struggle with. You know that 12 months ago, 18 months ago, 2 years ago, the system was not perfect. It was unfair. It was unjust. The people that you served weren't able to get access. People are still getting debt, struggles with filling out forms the right way, that your advocacy and organizing work was around changing the system to make it better for people in need. But now we're in a place where you're having to defend and protect a system that you also know is flawed, in some places broken for people. So how do you juxtapose both of those positions, knowing that there needs to be a radical overhaul, but at this point in time, we got to save the broken ship until we can get to the place of doing better. So Aija, I'm gonna start with you, and how you manage it as a leader and as an organization when it's right in front of us.
Yeah, it's a big question. It is something that so many of us are having to hold right now, knowing the system that we have had is entirely inadequate and lots of people are falling through the cracks, and those people are disproportionately people of color, queer people, low-income people, the most vulnerable in our system. At the same time, all of those people are going to be hurt so much harder as we lose what we have. For us, what I've been talking with my folks about is defense as offense. And I'm not a sports person. Will this metaphor make sense? I don't know. But we've been thinking about, what do we need to be doing to change the system big picture? And one piece of that at this moment is defense. The more that we lose what we have, the harder it's going to be to move forward. Some folks have a theory that I think has some legitimacy of, like, if the whole thing burns down and you start from scratch, you can build something better to begin with. And I totally understand that impulse. I also think it took us, like, I don't know, a century or something to get to where we are now.
Right.
Medicaid and Medicare were created in the 60s. It's been half a century since then. Yes, we have seen some erosion of those programs, but, like, it took so many people, so many movements to get us what we have. And to go back and do that work from scratch, I don't think it's realistic that is going to be an easier way to get to a transformed system.
Yeah.
So I think holding on to what we've got, and in that process, building power, right? Like strengthening up our movements, bringing more people in who do rely on Medicaid, who do rely on rural hospitals, who do rely on ACA premium tax credits, right? There's all these pieces that will allow us to bring more people into our movement if we're smart about it. And not just for one action, one bill, fight, whatever, but for the long haul. And politicizing them around, like, yes, Medicaid is critical to your survival. Step 1 is fighting to keep what we have. Step 2 is transforming that. And we're inviting you on the ride for the whole thing.
Yeah.
That's what I would start with.
So as a sports guy, your metaphor did work, and it is an important point. You got to hold the line somewhere, and it did take us a long time to get here. So glad to hear that perspective. Lindsey, how about you? How are you reconciling things in this moment? And what's your approach to holding on to a system that adds debt to people's lives, at the same time, still trying to find ways to reform it at the same time?
Yeah, the most widely cited and respected numbers are Kaiser Family Foundation's on medical debt from a couple years ago. Around 100 million Americans have medical debt. 40% of American adults have medical debt. As Aija was just saying, like, this is not a system that is working for people, and that makes it very hard, our perspective, to, like, feel like, okay, now we have to fight for this system, not to sort of, like, overemphasize the sports metaphor, but I think the question is, like, how can good defensive action change the terrain on which you're playing? And it can, in the ways, Aija, that you were just describing, but it's disorienting too, because from our perspective, our healthcare team spent a lot of time and energy working on getting the Consumer Financial Protection Bureau's rule to remove medical debt from credit reports through various types of coordinated public pressure campaigns, advocacy meetings, research, the whole 9 yards, only to have that rule, which was finalized in January, sort of flicked away pretty unceremoniously by a Trump-appointed judge. We've sort of, like, spent some time working through with members, asking ourselves, what does the fact that something that we put that much time and energy and genuine movement effort into, the fact that can be dismissed so readily. What does that teach us about the current political landscape? What does that teach us about how we have to move now, how we have to build power, how we have to connect with other people in our neighborhoods, in our communities? I think one of the things that becomes clear in this moment is that a lot of times it can be easy to sort of fall into a model where you're treating people, where you're treating them primarily as constituents who you're sort of making like relatively passive asks of. And I think what Debt Collective, what People's Action, what other orgs that we work with are trying to do is like develop people as organizers rather than constituents. But it's challenging. We don't want people to suffer more, and we also don't want to be content just to return to what seems like, if we were to just passively engage, would be like a slightly worse version, or dramatically worse version if we didn't engage at all.
So poignant. Organizing is hard work, and it's not for the faint at heart. And you both are committed to it, clearly by this conversation and by the work that you do every day. So I'm curious, what's your origin story? Lindsey, how'd you get into this work?
Yeah, we all have these experiences in our background, right? And I think increasingly it's hard to find people who haven't had their lives shaped by like some major terrible experience with the healthcare system, whether it be their own or that of a family member. And I went through a major health crisis in my early 20s that resulted in me accumulating a lot of medical debt because I didn't even know that there were certain relief programs that existed and that would have applied to me as someone with a very low income who was mostly doing food service work. And I did community organizing. I got involved in college and continued to. It wasn't until my late 20s that I started working on healthcare specifically. And my sister and I were the primary caregivers for our father during his fight with pancreatic cancer. Shortly after I was emerging from this medical emergency, which resulted in all kinds of encounters with the major failures of our healthcare system, with medical bills that couldn't be paid, with debt collector calls, and spent a lot of time feeling, not even consciously, but feeling what I can recognize now was sort of like embarrassed, ashamed. Oh my God, I'm, I have like 3 credit cards that are at their limit. And like, I don't want to tell anyone because I feel like I've been irresponsible, So I think that's why it's so important that we have these collective education programs that we learn those through. And I found myself eventually a series of events, did some organizing in Baltimore. My previous role before coming here was with the People's Action affiliate at Progressive Maryland, where I spent some time working on medical debt with a city and then statewide coalition, and then eventually found myself at Debt Collective leading the work there.
Wow. And you're right. I remember during my time, there were some hospitals who, when you were discharging and you couldn't pay the medical bill, they offer you the opportunity to get a credit card right there on the spot as a part of it and put the whole medical bill on the credit card. And so you walk out of the hospital feeling happy that you don't owe the hospital any money anymore until a month later that payment comes in the mail from the credit card company. And so that is something that is burdensome and overwhelming to people. So Aija, tell me a little bit about how you started in this work and what drove you to do it, what keeps you here too.
I've been organizing for about 15 years, and I also didn't come into the healthcare work until my late 20s. I started off doing student organizing when I was in college, but I think a lot of what brought me into organizing in the first place was early experiences with the healthcare system. I've had various ways that the healthcare system has failed me. The most fundamental one is growing up, my mom, she had cancer. She got diagnosed late. She was having pain in her armpit and went to the doctor, and they said, oh, it's probably a cyst or something. Don't worry about it. And that happened multiple times. Had she been a man, probably would have had a different result. Her pain might have been taken more seriously. And so by the time they caught it, it had already started spreading. So she ended up passing away from it when I was 6. She was 46. And what she lost, what I lost, what was lost because of the way that our system was not set up to really listen to her, that's egregious, right? That's what I'm fighting for people to not have to go through. Because ultimately, you come out, I think best case scenario, you get the care that you need and you get a bill. Right? That's like best case scenario in our system.
Yes.
Worst case scenario, you're going bankrupt. Worst case scenario, you're not getting the care you need at all. Worst case scenario, you're dying. real stakes. And actually, after she died, the only reason we didn't have medical debt coming out of that is because she actually was given the wrong bone marrow in a transplant. And that is not what killed her, but that is what led to a settlement, which meant that we could afford her care.
Wow.
I mean, our system is not broken. It's intended to be this way. It is awful and cruel from head to toe.
Yeah.
So I feel very privileged to be able to do this work and be able to fight with folks who the system is trying to chew up and spit out, but it doesn't have to be that way.
Yeah. Well, thank you for sharing. It resonates so deeply, your story and the experiences that are around it. My last question for you is something trying to be more on the positive side. We got federal DEI rollbacks that are happening, changes to the ACA, cuts to public health programs that are going to really be devastating. And it can be overwhelming for all of us to know that these are the headwinds that we're facing. So I wanted to ask, what gives you hope or what keeps you positive in this time of uncertainty and drastic change that doesn't seem to be change for the better? Aija, I'll start with you. What gives you hope and keeps you in a positive space?
Yeah. I mean, people are fighting, right? We just had one of the second biggest protests in U.S. history occurred this year. We're seeing people coming out who have not come out before, taking action, taking risks, realizing that they're impacted and a lot is on the line for them. Like throughout this Medicaid fight, I was like, it was hard to have hope. And, we did lose, right? Like, we can be plain about that. And throughout it, we knew it was a strong possibility we were going to lose. And yet, what are we going to do? We're not going to roll over and take it. Like, we have nothing to do but fight. Because we have so much on the line and so much at stake. And seeing the will and the perseverance of people to come out and take risks and work to knock back the system that's trying to beat them down, I think that's where I get hope from. And yeah, it's essential. That's what drives organizing, is hope.
Yeah, indeed. Fantastic. Lindsey, how about you?
I think similarly, seeing people fighting and fighting hard and fighting it with a kind of like a focus and rigor that feels like it's evolved. Like I started organizing in college 15 or 16 years ago now. There's been a lot that's happened in those 15 or 16 years, and seeing our forms of organization, even if they haven't been enough to stop this in its tracks, seeing them become stronger, become more resilient, seeing people take more active roles and seeing more and more people who have a real hunger for building a movement that's far stronger than it's been, that's far sharper and smarter than it's been. And that sort of coupled with like a real kind of refusal on people's part to just accept what we're seeing happen in the forms of these protests, in the forms of community defense work in Chicago, in Los Angeles, in the immigration courts in New York, people rising to the occasion, even without certain kind of like frameworks of experience. These things together make me hopeful, help me have that appetite and drive to keep fighting, to keep building. I can't really imagine what my life would look like without it. So here we are.
Awesome. Thank you both. I think rising to the occasion is something that you said is what we all hope for and are seeing evidence of. Thank you, Aija and Lindsey, for a great discussion and for the impactful work that you're doing in communities. To our returning listeners, we appreciate you for participating in these continued conversations. And if you're new here, welcome. We're happy that you found the intersection, and we hope that you stick around for more honest, insightful conversations like this one. Stay connected by visiting www.meetattheintersection.org, where you can sign up for our mailing list, catch updates on events, and access additional resources. And don't forget to join our growing LinkedIn community of advocates committed to advancing anti-racist healthcare systems. The views expressed here do not necessarily reflect the views of the Robert Wood Johnson Foundation. The foundation does not support lobbying efforts, including any activities or communications referenced during this podcast.